Good morning and welcome to the WellSteps webinar, the only realistic solution to America's poor health, presented by Dr. Stephen Aldana. This is Dr. Troy Adams. It is my privilege to be with you today to introduce Dr. Aldana. I'd also like to let you know that we have on the phone the Director of Operations for WellSteps, Ryan Isaacson, who will be handling questions behind the scene. Your phones have been muted. If you'd like to participate in the webinar at any time, feel free to do so by typing questions in the GoToWebinar control panel, which appears on the right side of your screen. During the webinar, toward the end of the webinar, we will take time to answer any questions that you might have. You're also free to add any comments that you would like at any time. There are about 700 of you on the webinar today. This has been one of the more popular webinars that we've done in quite a while. And we're glad to have Dr. Aldana with us. He brings all his expertise that you only get when you write a book. He spent, I know, an agonizing number of several months, probably close to 2 years, writing this book, The Culture Clash. And what he's going to share with you today comes, a lot of it comes out of the book. He's going to help us all understand that there is a problem in America and that the people who are supposed to be helping us solve the problem, those groups that have been tasked with sort of being watchers of the problem, aren't doing their job. And he's got a lot of good evidence to suggest that that is the case. And then he's going to help us understand a simple solution that I think will touch each of us at both a personal level, and those of us who work with wellness at the workplace will help us come up with some strategies we can implement in the work site to manage and help people there as well. Dr. Aldana just returned from an extensive trip. He's been in Montana. He's been, like that song, I've Been Everywhere, Man. He was down in Brazil for about a week, and he's one of the few people I know who's not only able to go to Brazil to do a presentation, but he was able to do his entire presentation and answer questions in Portuguese. In fact, I learned yesterday that Ryan Isaacson and Dr. Aldana had a 15-minute conversation on the phone in Portuguese. I truly work with an unusual group of people, and it is my privilege now to introduce our presenter today, Dr. Stephen Aldana.
Thanks, Troy. Unusual is a really nice way of saying weird, and it's a label that I wear proudly, and I learned a long time ago that not everybody thinks just like me, and that's really a good thing. It's good to be back on American soil and to talk about wellness. This is like my most favorite thing in the whole world to talk about, because I have a view, I have a vision, a perspective of why we in the wellness world, why those of us who practice helping people improve behaviors, why we're here, how we got here, how this whole thing has evolved, and more importantly, where all this is going. And I have spent more time thinking about this topic than probably anything else in my life, and trying to find solutions that really work. More importantly, trying to help people understand what those solutions are going to take and how this is all going to end up. So, Troy, I thank you for your kind words. I encourage all of you, feel free to ask questions by typing in any questions you have on the control panel on the right, and Ryan's behind the scenes answering questions. We'll do it all in English today, which will be good for everybody. But let's talk about an analogy, a metaphor, if you will, to kick this entire process off. I've done a lot of meetings in Cleveland, Ohio, and right through the center of Cleveland runs the Cuyahoga River. In 1976, a reporter from the Time magazine showed up because the river was on fire. The actual river itself was flaming. It had started and combusted, self-combusted all by itself, and it burned and burned for several days, several weeks, burned multiple warehouses and homes and destroyed property all over the area. They finally got the fire out, but it raged for a long, long time, and they tried really hard to get the fire out. Now remember, this is a river. This is like the resource that we're drinking and fish are swimming in. This is a river that spontaneously combusts. Well, what we learned from that event was this river had started on fire 11 times in the last 100 years. This is in the late 1970s when these pictures were taken. This is the first time the public really saw this. It had burst into flames 11 times since the mid 1800s, each time destroying properties, each time destroying warehouses, each time destroying jobs and livelihoods. But they would get the fire out, and they would go back to doing it again, and it would start up again. Well, this river was the source of all of the, what wasn't the source, it was the solution to all of the toxic waste and waste byproducts from all the manufacturings and steels and production that was going up and down that waterway. The pollution control of the day was to just dump it in the river. And they did. And no one really thought much about it. This is back before really the environmental days. By the way, the EPA, the Environmental Protection Agency, was started because of this work with the Cuyahoga River. But it's important because these factories provided jobs. This is about stimulating the economy. Remember, much of World War I and World War II was built and fabricated with the equipment that came out of this area, the steel mills and everything else. So remember, this is really about jobs. People need to eat. People need jobs. We build factories. We create jobs. Factories have waste. We dump it in the river. Nobody really cares. So we didn't care until it started on fire. In fact, the world really didn't care until we saw those pictures. But these factories were the works of Rockefellers and the big steel magnates. They were under pressure now, later after it started on fire, at time to do something about it. But every time the fire would start, they'd get the fire out, people would complain. People would then give money to the local politicians and say, no, we need to keep these places open. These are good jobs. So there was this vicious cycle between those who thought jobs would take priority over everything else, those who wanted money from industry to keep their businesses rolling, and industry itself who honestly didn't think there was a problem. Well, that combination of greed, need for jobs, economic stimulus, and what I call just basic corruption between industry and local politicians are really what caused the river to be what it was at that time. And it wasn't until it became public and environmental protection kicked in. And this is the river today. The river has been cleaned up pretty substantially. I've seen it. I jogged along it. It's not bad. It looks pretty good. There's even live fish in it now. But this is a big transformation. So this is a story that started off with a very clean, pristine river. Mankind came in and screwed it up horribly for 100 years. And finally, there was enough pushback from individuals to do something about it. And the reason I take this time to talk about the river is because there's two sides to that battle, that river. There's the group that wants to keep polluting, follow the money, local businesses are doing well, employees have jobs, politicians keep their status, the status quo is maintained. And then there's those who think the river should have been cleaned up. They want to protect the river. There's no money in protecting the river. In fact, it's going to cost money to clean the river up. Usually it's a grassroots effort of people who care and people who desire something a little bit better. Well, that's kind of the story of the river. That story is exactly the same story that we have when we talk about our good health. The battle that you and I and our employees have who are trying to understand why our health is bad, what is the main cause, and how we're going to solve this problem. There are two sides to our current battle for good health. On one side, there's the group that promotes poor health. Well, follow the money. Who is making money on our current unhealthy culture? If you think about it, we have an unhealthy culture. We have the highest rate of diabetes and obesity of any time in human history. Who makes money on the current system? Well, the food manufacturers do. The fast food industry does. The entire aspect of our society that makes money off the treatment of disease thinks our current system's pretty good. Healthcare providers, they're in the disease treatment business. Pharmaceuticals, lawyers, medical manufacturers, hospitals, insurance companies. They're in the business to process claims and treat disease. That's how they make their money, on the current system. So businesses profit from our current health status and our current culture. Employees, some of them are not that interested. Actually, employees is a mistake on that list. Politicians. How do politicians gain from our current system. Trust me, having spent some time in Washington and seeing the special interests that descend on our lawmakers who receive undue influence and money are doing all they can to protect the financial interests of those around them. Politicians need the money to keep elected, and groups that want to keep the status quo untouched will provide that money. So there are a number of groups that are very happy with the current culture that we have in our country today. Well, who wants better health? Who wants to change? Who has a desire for good health in this country? Well, there's no money in trying to create a healthy culture. The money is keeping the culture where it's at. This is a grassroots effort. These are underpaid, overworked wellness people from all across the United States, scraping by on pretty small, meager salaries, trying to help people stem the tide of our unhealthy culture. We're swimming against this current. There's no money in prevention. Dr. Aldana, we have mammography, colonoscopy, we have pap smears. I hear you, and that's great, and I'm all for that. There's money to be made there. That's not prevention, that's early detection. Early detection is finding the cancer when it's in its earliest stages, not preventing those cancer cells from starting in the first place. So there's very little money in prevention. If you're a hospital, are you really going to talk about prevention? How about a pharmaceutical company? Do you really want people to have no risk factors? How about a group that makes unhealthy, highly processed foods? And now you're going to switch that, or the fast food restaurants. So the desire for good health comes from those people who want a better way of life. We want to do something better. So let's just see how real this thing has become. Let's make this really personal for each of you. We know what happened to the Cuyahoga and had a good outcome. Right now, in comparison, our culture is ready to spontaneously combust, and there's not a lot of big change on the horizon. So let's just do a quick poll. I would like all of you listening today to think about a food that you crave. We've got a lot of you on the call today. I would like you to think about a food that you desire a lot, something that you think about. Now, I'm not talking about, I'm hungry, I think I'll have. I want something that you go, oh man, I really like that. Okay, picture that food, whatever it is in your mind, and then you tell me which of the following are in your food: salt, sugar, or fat. If I'm going to guess, there's at least 2, and in some cases 3 of these in that food that you listed. So I did a meeting a week ago, 2 weeks ago in Indianapolis. I did ask the same question. The lady came up to me and said, "Do you want to know what my food was?" And I go, "Sure." It was beer. I go, "Really? Beer?" That's the first time I've heard somebody list that they crave beer, but she really, really likes beer, which I'm okay with that. That's one exception I can think to this. It doesn't have salt, sugar, and fat in beer. Most of the foods that you mentioned do, however. My food that I talked about, I think about bacon. Something magical about bacon. I crave it. Some days I go, oh man, I'd love to have a piece of bacon. And I think I know why. It's because the fat gets into my mouth and I can feel that sensation, and it's room temperature, goes to mouth temperature, and it's the salt. Sometimes I just crave some kind of salty food. I like it. I don't eat very much of it, but I really like it. Maybe you listed chocolate, or maybe you listed a chocolate chip cookie. Maybe it was ice cream. Maybe it was Haagen-Dazs. I know we joke at WellSteps about all of our favorite foods. Without a doubt, with the exception of beer, every one of them includes salt, sugar, and or fat. And there's a reason. It's because your brain actually lights up. It's the pleasure centers of your brain light up when you consume these foods. They have what we call addictive properties. They cause us to want to return and repeat so that we can repeat the pleasurable experience. I talk about checking into a hotel and getting the chocolate chip cookie off the front counter what's hot. It's a pleasurable experience that I enjoy and that I want to repeat. So, you have all been influenced by a new culture that has promoted salt, sugar, and fat in everything that we eat commercially, and it has had an impact on you. It's part of this culture that I'm talking about. The real problem that we're facing in this country is a dramatic transformation of our foods and our exercise patterns so that we think this is a healthy lifestyle. We think Reese's Pieces and Captain Crunch and Lucky Charms and O's are somehow part of a delicious breakfast, and you have been marketing because the producers can make the foods that they do, and they can convince you that they're healthy. And there's money, enormous amounts of money to be made by the promotion of these highly processed foods. Cocoa Puffs. I like to joke about Cocoa Puffs. They're kind of like the epitome of all of this. It's highly processed corn flour with chocolate food flavoring, chocolate food coloring, high fructose corn syrup, all pressed into a small round ball. And it's somehow supposed to be part of a healthy breakfast in a strange way. And on the panel of that box, we see this American Heart Association recommendation saying this is part of a healthy diet. You ought to go here. How is it possible that Cocoa Puffs can get the blessing of the American Heart Association? Well, because Cocoa Puffs gives thousands of dollars every year to the American Heart Association for the right to put their blessing on the side of that box. General Mills wins because they get to sell more food because they know that you'll respond when you see the American Heart Association. The American Heart Association wins because they get lots of money. And you, the unsuspecting consumer, lose. One chapter in the book is called Win, Win, Lose. And you have no idea how much you have been manipulated by our current market into doing things that we shouldn't be doing but do. And we look at who wins and who doesn't. One of my favorite labels is on the back of a package that my son opened up. This product is to be enjoyed as part of a healthy, active lifestyle. Really? Is this really that good for me? Because it's Sour Patch soft and chewy candy. I mean, well, Dad, it's watermelon. It's watermelon flavor. It's a fruit. It's got to be good. So we consume, and we become somewhat addicted to these highly salty, sugary, fatty flavors like A&W root beers and double bacon, double melted, double hamburger, and I'm going to have 2 or 3 of those and some fries. And to top it off, I'm going to have a root beer float. Root beer float, salt, sugar, fat. Root beer float has the sugar and the fat in the ice cream. What about the hamburger? What 2 flavors? Salt and fat. What about the fries? Salt and fat. You get where I'm going with all this. We take that to the next level and we put it in the vending machines. So one of the school districts in my neighborhood has a $6.2 million annual contract with Pepsi to put Pepsi products in the schools. The school desperately needs the money, $6.2 million every year, the school district. Pepsi loves to have your money, and the students have the freedom to pick and choose as they will, and they get to exercise their constitution and purchase however they are free to purchase. But the federal government wants to make sure that our kids are protected, so they've set up a law that all vending machines are okay, but they need to be 100 feet from the cafeteria, or it's a violation of federal law. That's why you don't see them in the cafeteria. Wherever food is served has to be 100 feet away from the food that is served. They have to physically measure the distance, as if somehow that's going to make a difference. So we change. Those that seem to want to make a lot of money in the current system have convinced others that we should be free to choose how we like to eat or what we want to eat. And that it's not that the foods are bad. Everybody decides whether they do or don't eat unhealthy foods. It's up to them to decide. But you shouldn't restrict our freedoms to promote our foods any way you want, because that's bad for jobs. It's good for our economy. It's good for American families. It's a good way to go. In fact, one of the organizations that's here to support all of the good jobs in America is the U.S. Department of Agriculture. And who more to support farmers, agriculturers, and cattle growers of America than them? Maybe you've heard of Domino's Pizza and their new brand of artesian pizzas. New Select Sicilian and all the different flavors. What you don't know is that makeover from Domino's was a public-private enterprise made possible by Dairy Management Incorporated, the American Dairy Association, National Dairy Council, spent a whole bunch of money with your federal tax dollars to create opportunities for businesses to sell more cheese. So working with the U.S. Department of Agriculture, Dairy Management Incorporated worked specifically with Domino's Pizza to load that sucker up with as much cheese as they possibly can. And what they have found is that you, the inspecting consumer, will consume more. You will be able to eat as much as you possibly like. And it's good for jobs. So now we have a win-win-lose. The dairy farmers of America win because they get to have good jobs. Federal government wins because they're promoting good jobs. And you, the unsuspecting consumer, lose. So where does all this take us? Well, more fast food than ever, larger serving sizes than ever, more salt, sugar, and fat than we've ever had. If you look at the data, the percentage of meals eaten outside the home used to be in the low 20s, now it's in the mid 40s, soon to hit 50%. 50% of every meal we consume is consumed outside the home. And if you eat food outside the home, you get fewer servings of fruits, fewer servings of vegetables, fewer servings of whole grains, more saturated fat, and more added sugar than if you were to eat at home. On a food consumption data, this is what's really happened to us today. Cheese consumption is now at 30 pounds per person per year. Added fats, 75 pounds per person per year. And corn syrup is now topped out at 85 pounds per person per year. If you just look at those trends, see where we were back in the 50s, where we are today, it's pretty easy to see there's a big transformation that has occurred. And it has occurred because bacon is so stinking delicious. I mean, it's relatively inexpensive. It tastes really good. It's a celebration of life. And quite frankly, my brain loves it. I love it. It's great. I think about it. I'd love to have more right now. We have become manipulated by a system that has taken advantage of our genetic, our environmental or evolutionary desires for salt, sugar, and fat, to where they have manipulated our food supply system to where we buy, we crave it, we taste it, and we repeat. And we do it again and again and again. Well, now let's get to the solution of all of this. I like to sit back and think, how has this happened? How has our food supply changed so dramatically? How has it happened that white flour is now about the only flour we ever see? Who is really the group that's on guard, that should be watching out for us, that should be keeping these things from happening? I mean, who's watching, guarding the wall to protect us against such changes? Is there a group that has taken it upon themselves that all Americans should be eating healthy? Can you think of a group? Who's responsible for really, government? Who has pulled it upon themselves as their task, their mission to improve the health through nutritional changes of America? Well, it's the American Dietetics Association, the ADA. This is where registered dietitians come from. This is where they're promoted. This is their job, is to really educate Americans, industry about healthy nutritional practices. And this is their website. Now, it's never my intention, but usually by the end of every webinar or every presentation, I've offended at least half of the audience. So I might as well get started today. If I just sit back and I think to myself, how did we get here? Who should have been watching out? And how do we keep this from happening again? I'm going to be perfectly honest with you. The American Dietetic Association has their website, and you see these very thin models that they have on their website. You got these really healthy, really skinny women and men looking really good, eating really healthy. And yet, if I open up their journal, the Journal of the American Dietetic Association, I see huge advertisements from Nesquik chocolate milk and ConAgra and every major food producer in the United States advertising in their journals. And I'm thinking, we have the heaviest population in world history ever. And the one single group that should really have been putting their foot down and said, whoa, wait a minute, These are changes in our food supply system that should never have happened, who should have. They have not. So what I did is, rather than look at their website like this, I took it upon myself, because I'm a realist, I took it upon myself to redesign their website. So what I did is I replaced their images on their website with images that were more accurate of our current environment. I mean, really, I just got off the plane from Brazil. And when I got on the plane in Sao Paulo, Brazil, there's 300 people ready to board. I could spot every American in the airport because they all look like this, every single one of them. So while they should have been on guard, protecting us and helping us, while they're at the watchtower looking out for threats to Americans' health, we have become the heaviest population in world history, which makes me think maybe somebody's fallen down on the job, and they are. Again, it's not my intention to offend. I think the registered dietitians of America mean well. And there are few in that group that understand how our culture has changed exceptionally well. But I mean a few. Because when I go to their conference, I'm going to get hammered by Pam and Fleischmann's and Wesson and Peter Pan and Munch and Crunch and Park and Snack and Hunts and Chef Boyardee and Conagra. I'm going to see who's sponsoring that meeting. The American Dietetic Association is in bed with the industry so that they have become interdependent. The ADA would not exist without the money of industry. Industry would not have the blessing of the food scientist establishment without their money. They've bought their way into the good graces of those who should have never been bought in the first place. They have become corrupted. And they turn a blind eye when we see foods like, really, Lunchables, really? You see what's in Lunchables? This is the dinner. This is the Lunchables snack lunch. Reese's Pieces, got Ritz crackers, some processed cheese, some kind of strange looking processed ham, and some tongue fizzle. So you can build your own lunch with a cracker, some processed cheese, ham, and some tongue fizzle. All with the blessing of the American Dietetics Association. I mean, really? This is what we've really become? Because this doesn't even look like food. Neither does this. But according to our federal government, it's an excellent source of calcium. And it contains diced real peaches with real mozzarella cheese. So cheese, pizza, peaches, that's good, man. Farm animals, what can go wrong here? So we have allowed the industry to creep into our lives with the blessing of the American scientists in the nutrition field. And we create very interesting solutions to keep businesses happy, government happy, and the public kind of has to beware. So we do stuff like labels. Well, we want to educate and inform the consumer. The great thing about this label is it's going to dazzle you with brilliance. The average American has no clue what any of this means. It's beautiful. It's absolutely magnificent if I'm in the food industry, because I can still hide the nutrition quality or the poor quality of my food in this label, and unless you're a food accountant, you're never going to know it, because the average person has no clue what any of this means at all. It serves the industry exactly the way they want to be served. They want to continue to promote, with the blessing of the ADA, foods that are unhealthy and make you think that they are. Because our former Secretary of Health and Human Services, there's no such thing as a bad food. No. All foods are good. That's the message that interesting. That's a good message for jobs. That's how you keep jobs going. That's how you keep industry happy. It's all about personal responsibility. Our former Surgeon Generals, you got to choose well. This has gotten really complicated. This involves the money makers of our capitalistic system. This involves our federal government, which has done very little to help in this regard. It has done a lot to placate to the industry. It's created a mess. And I've said nothing about our lack of physical activity. I think the Segway is one of the most ingenious devices ever invented. It's truly an amazing application of technology. And yet it turns us into individuals who are no longer mobile. from our own physical activity. It's a precursor to, the diseases that follow inactivity and our traffic. And we sit in our cars. And there are fundamental cultural shifts that have occurred that have created this culture in which we now live. A culture in which, despite all the efforts of all of you to promote physical activity and well-being, our physical activity trends are pretty flat. If you look at the percentage of adults who exercise enough to get the benefits, over the last 10 or 12 years, we just got a slight increase in those trends. So I like to say, at the end of the day, the cause of our unhealthy behaviors, our elevated health risks, our obesity, our type 2 diabetes, our elevated prevalence of chronic disease is nothing more than a side effect or a dark side of capitalism. I don't believe, with the exception of the tobacco industry, I don't believe any of the industry manufacturers came into this thinking that they were going to cause harm and poor health be damned, we're going to sell. So I think they just kind of went along thinking there's nothing wrong with Cocoa Puffs. And yet we find ourselves in a position now where, despite all the blessings and benefits of having free capitalism and free markets, which really stimulate our economy, we're starting to see some bad side effects. So in summary, food manufacturers, government, pharmaceuticals, our current disease treatment healthcare system, labor-saving devices, technology, greed, they have created a culture that reduces healthy behaviors, produces elevated health risks and chronic diseases. And while we've increased our food supply for fats, salts, and sugars, our obesity trend continues to go. You've seen this. This is us in the United States. This is the last 100 years, or excuse me, the last 50 years. You all know this data. What you may not know is that this culture, this side effect of our capitalistic system, it's not just our problem. It's occurring all over the globe. It's occurring in Korea, in France, in Austria, in Canada, in England. And 2 days ago, I got back from Brazil. Way to go, Brazil. Welcome to the Western world. You guys are right there with us. So when you look at this data, this problem is not ours. This is a side effect of Western living. It affects every westernized society in the world. And as other countries become westernized, they become like us. Their food supply becomes like ours. And the poor health behaviors, elevated health risks, and chronic disease profile that the US population has becomes the risk and disease profile of the rest of the world. So let's summarize where we're at. So far, poor health is a side effect of our Western culture. It is a cultural phenomenon. The culture that we have around us now is not going to change on its own. I write extensively about this business of self-regulation, letting industry self-regulate, letting groups self-regulate. There, in my mind, there is no such thing as self-regulation. Self-regulation, deregulation, lack of government oversight is a license for disaster. The side effect of capitalism where it's at, and it's going to continue to get worse. I don't see a whole lot changing this. And by that I mean our federal government, you all know this, and those of you who are listening from the United States, it's pretty tough for them to get along and get anything done, anything meaningful, without so much bickering. State governments have more capacity to do some things. And it's not that a few things don't come out every once in a while, but remember, government is here to help us have a robust economy and to maybe protect the citizens. So while we're trying to promote jobs and stimulate the economy, we kind of cut corners, take money, pass laws, turn away our blind eye so that we can continue to keep jobs and your economy going, despite the fact we've now created this massive health detriment across our entire country. So it's the solution. I mean, how do we solve this problem? And I welcome all of you to pipe in and type questions, because I don't have all the answers. I've thought and thought and thought, and a lot of my ideas are pretty weird. But I don't know how else to explain this one. There's always somebody in our society, in our family. There's always one person that always eats a little different. They exercise regularly. There's certain foods they do or don't eat. You go to a meeting, you talk to people. There's always Aunt Thelma or Mary Lou, whoever it is, or Bob over there in payroll, or Dave who works the line. There's always somebody who packs his own lunch. He's got fruits and vegetables, makes time to be physically active. There's always this couple that, for reasons I'm not quite fully aware of, are not like everybody else. They do things differently. They view the world differently. They march to the beat of a different drum. This couple, for example, lives in the same neighborhood, in the same environment, in the same community, is exposed to the same quantity of Cocoa Puffs, high fructose corn syrup, refined flours, sedentary lifestyle as I am, and yet they don't struggle with obesity and excess weight and diabetes. And I figured out why. It's because they live right there. Yeah, this is where they live. They live on this little island. They're surrounded by nothing. There's no influences that can touch them. And there's kind of some truth. They don't live there, but it's the concept. They do live there. They live in a place where they are free from, or they have decided to remove themselves from, the influences of the culture that surround them. They eat differently. Their serving sizes are different. There are restaurants they do or don't go to. There's a schedule that they've created in their life to be physically active. They make time to prepare healthy meals at home. They do things differently as a couple. They have created an island of health. A place where it's easier to be healthy, to maintain the culture that promotes healthy behaviors and a healthy lifestyle, rather than the other way around. Now, maybe it's not just a couple. Maybe a group of employees get together and they create an environment at work where the foods that are served, the time to be active, the amount of stress in their lives, and the influences these have on their home lives are influenced by their work site. So that the work site itself, a collection of individuals, all attempting to have good behaviors and a healthy lifestyle, create what I call a larger island of health, a work site, if you will, a place where things are done differently. Now, these are isolated pockets. Based on the data in the United States on obesity and everything else, these pockets are very, very rare. There's not very many of us. Most of the people who have been successful at creating an island of health, a lot, are listening to my voice right now. Like the Matrix or one of the, you are the resistance. If you're listening to the sound of my voice, you get it. You've done something different in your life. I guarantee you, those of you who claim to have a wellness lifestyle, there's places you don't eat. There are foods you don't eat. If you do, you don't eat very much. There are times in your day where you drop everything and you go. There are times in your day where you find peace and quiet for stress, for family, for religion, for spirituality. You do things differently. So it's not like this can't be done. There are lots of you who do this. The question now becomes, how did you do it? How did you create your own island of health? How did you make it work? Well, this is where we talk and talk and talk. How do we create a new culture? Well, war is one way to do it. If the US and the Allies had not been successful at the end of World War II, we'd all be speaking German right now. And I guarantee you we'd have a different culture. That's not a way I recommend it, but wars have happened in the world history for a long time, and cultures have been completely eliminated and reborn and assimilated, and that's one way it happens. Other ways it can happen is through gradual changes through individuals who change and make long-term change. How do you decide what to eat for a breakfast and why? Well, that's a behavior. Now we're getting back to something we talk about at WellSteps all the time. And that's this whole business of how do you change behavior? How do you get people like you listening today to do this? We've always identified the 4 main steps here: education and awareness, motivation, skills and tools, policy and environment. Of the 4, which ones are the most important in really getting people to change, which ones are the ones have the most impact. Well, education and awareness is only 5% of the mix. Motivation, 30, skills and tools, 25. Policy and environment, really important. So when we look at those 4 items, I split it into 3 categories. This is what I do. Number 1, you've got to find a reason to change. If you don't have a reason to change, nothing's going to happen. And according to this little model that we use at WellSteps that we created, it's these first 2 items. A reason to change is really education and awareness and motivation. So if you think about awareness, hey, watch this high blood pressure video. I'm creating awareness, but what I'm really doing is I'm trying to give you a reason to change. If I educate you by handing out a flyer or do a biometric screening to let you see your risk or health risk appraisal, I'm hoping to give you a reason to change. Combined with motivation, now we have reasons to change. So, and you know all about this. We've been hammering on this for years at WellSteps. Education, preventative screening, that's awareness. Motivation, intrinsic versus extrinsic motivators. We talk about sticks and carrots, and you all get all this. And if you really, really, really want to know how to do this well, go watch our recorded webinars on getting motivation or motivating the unmotivated. Well, part 2, you've got to learn the skills. And according to our model, it's this piece right here. You've got to learn new skills. You've got to be able to make healthy choices, make them easier. You've got to learn to cook things. You've got to learn to shop differently. You've got to learn to drive past that restaurant that you would normally go to. You've got to learn to balance your work-life balance so that you can find time to be active and to exercise. You've got to find a way to commute less, maybe work from home more. Find skills and tools to help you leverage these new behaviors. Because without the right skills and tools, the odds of you being successful are very limited. You know, we create a lot of tools at WellSteps to help people do this. A ton of demo videos that show me how to do this. Tell me more. This is an important piece of it. Because you don't have the right tools, we're not there. So help me make fast food selections. Teach me and show me how to prepare healthy foods or how to pick healthy foods at the grocery store. Schedule my time, learn to be active, balance my time, show me. Part 3 of this is get help from others. On our model, it's this last one. Now, we say help from others, which includes policy and environment. They're really important. The fact that policy and environment sound a little sterile and a little cold, I don't want you to feel that way. Help from others means I got to have other people who can help me do this. Other people who can share with me in the experience or join me in the journey. A significant other, a family member, a friend or neighbor. They have to be involved. So I've got to have spouses and other people. I've got to have policies at work that reward healthy behaviors, maybe an outcome-based rewards program, maybe a premium differential at work. I've got to have a healthy environment at home and at work if I'm going to pull this off. And that's why we talk an enormous amount about policy. We have the WellSteps checklist to change. It's a free tool to help people go through these kinds of things. One of my favorite campaigns is Food Makeover. Well, we go through your refrigerator and we go through your cupboards. My wife is really good about this. There are foods that she really, really likes, but knows she shouldn't eat very much. She calls them contraband. And to keep us from bringing contraband home, she has created an imaginary moat around our house to keep the enemy at bay. You're not allowed to bring those foods into the castle. Those foods cannot come in. You got to keep them out. So you go to the grocery store and you make food selections and you see everything that's here. If you don't buy it, you won't bring it home. If you don't bring it home, you won't eat it. You'll be stuck eating the healthy foods that you have at home. You are creating an island of health, different from the one the market, the ADA, the federal government, and everybody else wants you to consume and purchase and be part of. You have done things differently. And it might be just you. Just you. Maybe you and your cat, or maybe you and your dog, or your brother, or your mom, where we're going to make some steps and do this together. I like to say, with the groups we work with, WellSteps, we create work sites that are islands of health. And eventually, these islands connect. We're connecting right now. Right now, with using technology in this webinar, you who have created islands of health are connecting with others who have also created an island of health. And we're creating this network, a web that is starting to expand. Now, once we start to expand, we start to have an influence. Now, I can't speak for where you live and where you're at, but I will speak that from my perspective, as one who travels a lot and sees a lot, we're always going to have Arby's and Burger King and McDonald's. The big ones are still going to be there. I'm starting to see fewer of the major fast food restaurants and more of the healthier restaurants, like a Panera Bread or some of the soup and salad or some of the Thai. I'm starting to see more and more of the really foods in their natural form places to eat. Even I'm out in Utah, and we're pretty backwards out here in some things. Very conservative state. I go to some of these places and they're packed with people eating healthier selections. So this web of islands of people starting to connect is starting to expand, and the market is starting to respond with foods, products, restaurants, things that will supply them for those demands. This is a bottom-up approach, not a top-down approach. It's not going to come from our federal government. It's not going to come from self-regulation through the market. The carriers, the insurance providers, the medical community, the pharmaceutical community, no offense, they mean well. And there's some there that are really serious about this, but get real. They're in the disease business, and it is a business. It's not going to go away. They're not going to change because they think that maybe we're doing this a little bit wrong. That's never going to happen. This is going to start with you and me and everybody else from the bottom up. So right now, the river is pretty yucky. Right now, we look at it and we go, holy cow, it shouldn't look this way. But things are going to change going forward. We already have it. We're expanding. Again, my work, Dr. Adams and others, we're seeing this expand around the globe as we try to do more and more to create a new culture, just change the status quo. So let's summarize. Poor health is a side effect of our Western culture. It's not going to change on its own. It's going to be you and me, employers, wellness providers, and brokers. We're going to get together and we're going to help groups do this better. The only solution is to create our own culture of health, an island of health. Bottom-up approach. Eventually the islands connect. When they connect, we start to influence the larger culture to a large degree. Now this has been about 40 minutes of talk from me. I haven't heard much from you. I have yet to even barely scratch the surface about how we solve this problem. And that's why I worked with Wellcoa. I worked with the publisher to get the book created. And today only, the hardcover of the book is $9.95. It's usually $19.95. The electronic version is the same price, $9.95. cultureclashbook.com. You can get it there today. They'll ship it out today. It's $9. It does what I can't do in 45 minutes. It really gives us the nuts and bolts about how this is going to happen. And then lastly, May 30th, next month, Dr. Adams is going to get to the real meat of this whole discussion, is how do we get leadership? How do we get business leaders to support wellness? How do we get this tough sell to an HR or a benefits person? How do we focus on Benefits Betty? How do we convince them to convince leadership that wellness is something we need to do? What tactics do we have available? What tools are available? We developed a brand new tool called the Wellness Budget Calculator that can show you, one of the tools at our tools page at WellSteps can show you where you can find money to do wellness without having to create a new budget line. And it's a great tool that does some benefits plan design change and some incentive plan change to create a budget for that. Having said that, Troy, Ryan, we got some Q&A.
You know what we have is a bunch of people who've standing up to testify, Steve. We have very few questions and a lot of people who are just saying amen in a lot of ways. And I like to share some of those comments because I think some of them are very relevant. Um, First of all, I just like to acknowledge that I have a strange and very powerful craving for bacon for some reason. I can't really explain. Joe, when you were talking about bacon, Joe typed in, this is the only thing he put in his question, chips with 3 exclamation points. So you must have struck a resonant chord out there somewhere. Um, Michael says there is no one, all caps, out there looking out for us. I think he got that point loud and clear. And then Felicia shared this, which I thought was great. She had these 2 quotes. One from Michael Pollan: "Don't eat anything your great grandmother wouldn't recognize as food." That's a great rule of thumb. And then this one is awesome from Upton Sinclair. She said, "It is difficult to get a man to understand something when his salary depends on his not understanding it." And I think that's exactly what you're saying with the people that should be protecting us but aren't. And then another webinar participant said that she's really glad that you called out the ADA for their double standards, and points that the ADA is an organization that is basically made it their business to discredit other credible organizations around nutrition and lifestyle. And they're discrediting trained health coaches who are more informed and sincere, passionate about foods and nutrition than they will ever be. And I think that you had a similar experience in your academic life, Steve. And then this is the one question I'll lead with. This is from Amy, and I think this is a sincere question. She said, so foods do not have to meet some kind of guideline to get the AHA stamp. And I think she really means that. So maybe just go back and cover that a little bit and answer that question for Amy.
Well, there's obviously the Food and Drug Administration, and manufacturers can't produce something that's going to cause harm to a large degree. That excludes the supplement industry. They are not under the regulatory impacts of the FDA. But if they do something hard, they can always be sued. Having said that, the mantra within government and within the ADA and within the food producers is there's no such thing as a bad food. And their philosophy is, if you eat in moderation and if you're careful, none of the foods that are available for human consumption are really like poisonous or toxic or something like that. But if that were true, we wouldn't have obesity and diabetes that we have today. Now, I'm not identifying a single food, but there is the possibility, there is such as a thing as too much and too many and too much of the wrong kinds. Food quantity and food quality have changed dramatically. So the ADA doesn't necessarily have to approve or disapprove anything. They're not even regulatory. They're a professional organization, many of which those individuals leave the ADA and go to work for the federal government in the U.S. Department of Agriculture, making food label decisions, making food safety decisions, making food production decisions, inventing new foods. All these different foods have been invented by somebody. Most nutrition departments are made up of the nutrition people and the food science people. They're in the same departments. So one guy's adding soda to yogurt to create a new delicious sweet yogurt treat, and the other one's down the hall talking about type 2 diabetes, and they're in the same department. So we get this. We get this kind of change all the time. The ADA means well, and I really sincerely believe that. They are so, they have become the high priests of the nutrition world, and their word is final. And they don't know it, but the head of the snake has become corrupted. And they should just look in the mirror and see how big we have become. And I wish they will. I really do. And I like them. But they've got to stop at one point in time and say, it's enough. We're off course here. Now, I'm not going to put all the blame on them. We like salt, sugar, and fat. And so, of course, they're going to sell us foods full of salt, sugar, and fat. It's a human tendency for us to crave those foods. So we load them up, and we drink, and we eat, and we gain, and we get bigger. And employers, unfortunately, are the groups having the biggest impact from the dark side of this capitalistic system, because we're paying the cost side of it. we're paying for the absenteeism, presenteeism, and the workers' comp and the healthcare cost side of the equation. And then people suffer. People suffer from it dramatically, which is why I was in Brazil. You know, their diabetes rates and their obesity rates are exploding. They're having the same problems we're having here.
Thank you, Steve. Here's a very interesting question from Kathy. She said she wants to know. She acknowledges the fact that there certainly are some individual things that need to happen here, but she wants to know what can employers do to help in terms of programs to help employees make these changes that are necessary, especially when maybe she's employed by an industry that produces foods that are not quite as healthy. It's a very challenging problem.
Procter and Gamble approached me about buying like 100,000 copies of our Stop and Go grocery guide, where we color coded all the grocery foods. And we talked. I gave them copies. Then they discovered that Pringles was one of the items that was in the guide that is colored red. Pringles is like the epitome of food science industrialized Frankenization. It's just a amazingly processed product. Because we colored them red, saying, you know, you probably ought not to go here with Pringles, they decided they couldn't do it. And I completely understand that. A year later, they sold off the Pringles division to another group. Then they called up later and said, hey, we'd like some books now. We don't own that crappy stuff, which I thought was kind of funny. What do you do if you're inside the organization and you have one of these foods? You know, there's probably some good foods that you have. Those should be promoted even higher and encouraged. You can turn a blind eye, which you probably should if you want to keep your job. It's like Wendy's. Wendy's came out with the baked potato and their chili and their fresh salads and their gourmet salads. And at the exact same time, they came out with the Baconator. So they're kind of playing both sides of the fence. And that's not going to change. And your company's not going to change as long as there's ready and able people who want to plunk down money for those foods. I wouldn't worry about it so much. What I would do within my organization is I would try to help our employees make the healthiest choices possible, and I would just ignore the fact that we sell some foods that aren't so good. I think they already know that, but I don't care. The people who run the wellness program at Altria used to be Philip Morris, the cigarette company. Get this, Philip Morris has a wellness program. They really do, for their employees. And I had to ask her, I said, do you guys have a smoking cessation program? I just had to ask. She says, no, we don't have that. She says, in fact, if you come to the corporate office, the front desk has multiple versions of our products pre-lit, ready for the public to consume any way they wish. She says, we have a wellness program. We do all we can. We don't have a tobacco program. We don't have a tobacco policy. You can smoke anywhere, anytime you want. So if you're a wellness person doing wellness in a company that has some unhealthy food supplies, talk a lot about physical activity. Talk about stress. Talk about all the other things you can work on, and all those things will help.
Thanks, Steve. We have a comment from Joanna, who is a wellness coordinator in Cuyahoga, and thanks you for your illustration about her beloved river. And she loved the culprit and cure and wants to know what basic new ideas are addressed in the new book compared to the culprit and cure. And Joanne, I just want to tell you that the webinar today is based largely in part on the ideas and thoughts that are contained in the Culture Clash. If you want to learn more about that, Steve mentioned that there was a special offer on the book. I don't know, Steve, if you wanted to add anything to that.
Culprit and the Cure was really about helping individuals have health and what decisions they can make. It was kind of the why and the how of healthy living. Culture Clash is more of helping individuals put our poor health in its right perspective. One, how do we get here? Two, how are we going to get out? And what are the things that I can do specifically as an individual and as a company to help create a new culture? I mean, if this is the only solution, and as far as I can tell, it is the only one, if it is the only solution to us having long-term wellness, specifically, step by step, what are the things that I need to do as an individual to see that I create this new island of health? Who do I get to help me? What do I need to do? What do I do about schools? And what evidence do you have that any of these things actually work? So it's a very different approach than the culprit and the cure. I talk a lot about, hands-on nutrition, physical activity, and the whys and the whats, and the physiological parts of it. This is different. This is really, in my mind, this is the big picture. This is the battle. These are who are on both sides of the battle. And this is ultimately the strategy that's going to get us out of this mess.
Steve, there are probably way more questions than we'll ever have time to handle in this webinar. I think that was a suitable way to end the webinar today. I would like to, on behalf of Dr. Aldana and Ryan Isaacson and the rest of us at WellSteps, we would like to thank you for your participation, your investment and time with us on this webinar today. We hope you'll join us for our webinar next month about helping senior leaders get on board the wellness bus. Again, we thank you and we wish all of you a fantastic weekend.